Avery. It's nice to meet you. I'll be working with you today. I can take your paperwork.
Hi, I'm Margaret. I filled it all out this morning. This is Frank. We're so excited to be here today.
Hello. Hi. So, did you guys find your way here okay?
Yeah, we had no problems. It's so much bigger than I expected.
Yeah, we tend to get that a lot. We have a very nice clinic. So tell me a little bit about why you're here today.
I had stroke, speaking difficult.
Okay. Can you tell me some more about your communication difficulties and maybe the things that you struggle with?
Speech, challenging, often.
He had a stroke, when was it? 18 months ago. It's September now. 18 months ago. And the doctors told us he had Broca's aphasia. Now he has a hard time telling people directly what he wants or needs.
Okay. I see here that you received services immediately following the stroke at Grace Sloan Memorial Hospital. Can you tell me a little bit about your experience there?
Damn hospital, damn.
Oh, don't even get us started. He was so upset that he had to stay in the hospital for services. He didn't like the nurses, or the food, or the smell, or sharing a room. It was all loud and chaotic for him. He was miserable. Our center right now is just so peaceful.
Yeah, that can be common in a hospital, to be a little bit overwhelming. Can you elaborate on speech improvements that you may have seen when you were receiving services in the hospital?
His speech was increasing pretty rapidly in the hospital while working with the therapist. But once he was discharged, we felt he would continue making improvements on his own.
Okay. Do you feel that he's made improvements since he stopped working with the speech pathologist there?
He really hasn't improved a lot since we left.
Okay, so how about immediately following the stroke? How did you feel about communicating with Frank?
Before therapy, he was only able to give me yes and no responses at the hospital. I even had a lot of difficulty talking to him, and we've been married for 40 years.
Difficult. Yes.
Okay, so overall, you still find speech difficult. What do you wish to get out of therapy now?
We decided it was time to come back to therapy because we thought improvements would continue, but there are still areas in his life that we just want to improve on and make easier. Frank kind of reached a point where he plateaued, and I feel like he still needs improvement. He still struggles with expressing his wants and needs, and I just think it would make a big difference for him.
Okay. Yeah, that tends to happen following a stroke, but I believe that coming here was a great step to initiating further improvement. How do you feel about this, Frank?
Okay.
What are your goals? What would you like to improve on specifically?
Better talking, saying red, black, deal.
He's talking about playing poker, but I'm more concerned with communicating necessities like meals.
Okay, well, why don't we talk about poker for a minute, because Frank seems to be interested. He brought it up, but then we can shift gears back towards what you feel he needs to work on. Frank, so you enjoy poker. How often do you play? Two times a week, 2 times a month.
A week.
Okay, and do you find it difficult to recall poker terms?
Terms? No. My friends?
Okay, so you find it difficult to speak with your friends while you're playing poker?
Yes.
We aren't here to talk about his gambling. We're more concerned about him communicating his needs.
Okay, I understand where you're coming from. It's great that you want to prioritize basic necessities. However, it is important to understand how clients socialize in order to improve their daily lives. But we can definitely incorporate both into therapy because they do go hand in hand.
Okay. I just want to make sure we focus on things that will make him more independent.
Right, and independence is very important, so we will be sure to work on it little by little. In what area or areas do you feel that your independent needs improving?
The staff at the center have a difficult time understanding him because he only uses like a few words and it's not really the ones he wants usually. Like he'll say sandwich, for example, but he won't say which kind. And then the staff brings him one and it's the wrong one and he's miserable all night because he's just so frustrated.
Okay, so it seems like we need to work on maybe expanding utterances, using more descriptive words.
Last week, want potatoes?
So you wanted potatoes.
Yes. Mashed.
Last week he wanted mashed potatoes. What was it you said? I think it was mashed potatoes hot or potato hot. So they gave him a baked potato. When it arrived, he was just frustrated because, like I said, it's not what he wanted. And he's just getting sick of it by now.
Okay, so obviously you talk to staff daily. Are they aware that you've had a stroke?
Yes.
Some do. It depends. We go on weekly trips in the community, and it can be difficult to talk to those people, like the bus driver, cashiers, or people around town.
Okay, that's great that your center includes things like that. But outside of the field trips, is there anyone else that you communicate maybe over the phone or that you speak with daily at the center?
Yes. My son, Lorenzo.
Lorenzo calls him a few times a week, and their conversations haven't been the same since before the stroke.
Wants long conversation.
He's coming up with our grandchildren to visit in a few months, and we're so excited, but they haven't seen him since before the stroke. I want Frank to be able to communicate with the grandkids, and I'm sure he does too.
Okay, that's definitely something to look forward to and something that we can be working towards. But it seems like between the grandchildren, the phone calls, and playing poker, there are definitely a lot of social concerns and demands. So I believe that working on expanding his speech will help him with overall communication.
Oh yes, we're willing to work on studies at home as well, whatever will help him improve.
I want improve, but so much.
I know it can seem like a lot. I don't want you to get overwhelmed because we will take it a little bit at a time. Even coming in today was a great step. We will definitely go at a pace that you are comfortable with. And you do seem to have a great support system at home with Margaret, so.
Frank, it'll be so great for you to get back to your long conversations with Lorenzo.
Yeah.
It is great that you are both excited and motivated, but I really do want you to understand that improvement's going to be a work in progress and it is going to take some time.
Okay.
I mean, typically the biggest improvement comes immediately following the stroke, so we may not see as large of an improvement like you did in the past, but that doesn't mean you should get discouraged or lose hope. we will definitely work towards this.
I will work hard.
Great, and I think you should keep that mindset. I'm looking forward to working hard with you as well. So let's touch on a few other items on the form here. I see that you indicated that mornings work best. Is this still true?
Well, actually, I recently picked up water aerobics in the morning, and I would like to be able to attend with Frank. So if it's possible to switch to afternoons, I think that would be best for us, so I can come.
Okay, great. So I'll make note of that, and on your way out today, I will let my secretary know and have them touch base with you about future scheduling.
Okay, perfect.
Hi, so my name is Avery. I'll be asking you guys some questions today. So I see your name is Frank. Safe to assume you're the wife. So you guys live together in a center. You're 87. You were referred here by your doctor for a stroke, and you now have Broca's aphasia, pretty typical. Your concerns are speech, whatever. Problem was first noticed about 18 months ago. And I see that you want to see me in the mornings,
Well, actually.
around like 8 a.m.?
Well, we were thinking.
Okay, great. So it was nice talking with you guys. We'll see you next week.
So his speech was increasing rapidly in the hospital while we were working with SLP. However, once he was discharged, we felt he would continue making improvements on his own.
Oh, okay. So why did you think that? Because I went to school for 6 years to be able to help with speech. Did you just think that you could just help with his speech? Do you think it was just gonna like black deal?
He's talking about poker, but I think we need to talk about him discussing his needs and wants. I think that's more important.
We're going to talk about poker. We're not talking about that right now. No, we're going back to poker. Frank, how do you feel about poker?
Cards.
So my name is Avery. I didn't eat lunch today, sorry. We're gonna be talking about, why you're here. So. Good.
We felt challenged trying to develop a clinically accurate scenario for a client that we knew very little about. Due to our prompt being very vague, we were left with a lot of different possible directions for our case history. One thing we found difficult was not knowing this person's past or any other information other than what was given. We wanted to make sure that the way the clinician and the client interacted was fitting to the prompt and to the character that we created. We decided on Broca's aphasia, but it was the small nuances of Frank and Margaret's personalities and characters that made writing the script more challenging than we anticipated. We wanted them to be true to the roles we gave them throughout the duration of the case history interview, so we often spend a lot of time reflecting on what these individuals may say or do in their daily lives. Giving them a life and establishing their daily routines was not challenging. What was difficult was applying their daily lives into the clinical interview to understand which aspects of Frank's difficulties were most important to him and his spouse that they wanted targeted.
Beyond his personality, we also wanted Frank to present with Broca's aphasia as a genuine client might. Throughout, we felt challenged ensuring that the client's responses were typical or along the lines of how an individual with Broca's aphasia would respond. We were all confident in contributing knowledge we obtained in previous classes. However, we knew we needed to research more about exactly how individuals with Broca's aphasia present. Specifically, what difficulties are most prominent and how caregivers can be involved in the recovery process. We knew that it was crucial to give individuals with Broca's aphasia time to respond, but actually applying that was a bit challenging. After our first recording, we realized that we had focused more heavily on addressing the caregiver than the client. As a result, we decided to alter the script to include more patient input.
It was interesting to have so many different points of views and ideas while trying to form the script. There were moments where we each wanted to take the scenario in different directions. However, we had to come up with ways to incorporate all of our ideas while being clinically correct. This project was a great opportunity to practice working and collaborating with other professionals. It allowed for group problem solving and for learning more about developing case history interview questions. We were all able to learn from each other while also learning to respect each other's opinions and thoughts. Working with others is a large component in our field, so being able to actually carry out this skill takes practice, which this assignment provided.